Hello, everyone. I hope you're well. My name is Ravi Agrawal. I'm the managing editor of Foreign Policy magazine, and it's my pleasure to welcome you to today's FP Insider Call on the coronavirus crisis, what the rest of 2020 will look like, this great cursed year, 2020. As you know, we do these calls regularly, and if you're an insider subscriber, you get to join in and ask questions too. Now, I know Zoom-based events are quite common these days, but this one's really important. The United States had more than 75,000 new coronavirus cases on Thursday. That's a new daily record and the 11th time in the past month that this record has been broken. Why is that happening, and what does America need to do next? Meanwhile, India's coronavirus cases surged past 1 million today. We're going to take a glance around the world and preview FP's new COVID-19 index just for insider subscribers, in which we rank how countries have handled their outbreaks and lessons that there are to learn from them. Now, all of that gives you a sense of why we're convening. A quick word about how we're setting up the housekeeping notes. We want to hear from you. We want to engage with you. So we've reserved a portion of this event for questions from you, our audience. So write us. If you're on Zoom, click on the Q&A button and submit your questions. Tell us your name, where you're writing from, and be sure to direct your question at a particular speaker. If you're joining us on the phone or via live stream, you can email us your questions. The address is events@foreignpolicy.com. So let's get started. FP's very own Alison Carlson, who led the development of FP's COVID-19 index, will join us later in this half-hour call. But first, I'm joined by a guest who's become a fixture on cable TV news for his calm and smart analysis. Dr. Ashish Jha is a professor of global health and the director of Harvard's Global Health Institute. He joins us from Boston. Welcome, Dr. Jha.
Good morning. Thank you so much for having me on, Ravi.
Good to have you back. So, Dr. Jha, let's start with the United States. 75,000 new cases recorded on Thursday. Are you surprised?
No, unfortunately not. 2 weeks ago, speaking in front of Congress, Dr. Tony Fauci said that he thought that if we didn't get our act together, we would have as many as 100,000 new cases soon. We were in the 40s then. So maybe I'm a little surprised that we've hit 70s so fast, but we are heading in the wrong direction and doing so quickly.
And do you think it's likely then, given where we are now, that we will see something in the range of 100,000 cases, new cases a day sometime in the fall?
I don't think it'll happen sometime in the fall, Ravi. I think it's going to happen sometime in the next few weeks. So while we are still very much in the summer. Now, I would love to be wrong, but for me to be wrong, we'd have to see aggressive action on the part of either the federal government or of a whole host of governors across the South and West. And I'm not sure that I'm seeing that yet.
Now, the news this week is that the Trump administration ordered hospitals to bypass the CDC and send all COVID-19 patient information to a central database in Washington, run by the Department of Health and Human Services. That process began in part on Wednesday. What do you make of the move?
Yeah, so look, the CDC has had some issues with data, and a reasonable person could easily argue that we need a better data system. I think that part's fine. But generally, when you have an organization that is generally pretty effective, as the CDC has close relationships with hospitals, if there's a problem, you want to fix it. So I've been really puzzled by why they want to build a whole different infrastructure. Of course, there are all sorts of assumptions that it's to bypass and not share data with the U.S. with the American people. My feeling is we should work with the CDC. We should fix whatever data problems there are. And ultimately, if you want to create a different data stream, you've got to make sure it's completely transparent, open. It's paid for by American taxpayers. It's got to be available to American taxpayers.
There was a period back in May and June when it was just beginning to look like the first wave might have peaked. Well, it turns out we're still very much in the first wave, and it's getting twice as big. You hinted at this, but what are the things that the United States could have done better and can still do better at this point?
Yeah, it's really funny. If you go back to kind of mid-May, early to mid-May, the White House released a set of guidelines called Opening Up America Again. And while I had a few quibbles with some of the things in it, it was largely right. It was largely well done. And if states in America had followed those guidelines, if the president had followed his own guidelines, we would be in a very different position. But they didn't. And the president encouraged people not to follow the White House's own guidelines. And what has happened is a large number of states opened too quickly. They weren't ready. They didn't meet the guidelines. And they opened up too aggressively. And then for weeks, the president and the vice president, writing extensively, denied that there was a problem as cases started rising. And now, of course, we are where we are, really neck deep in COVID in large parts of the country, with the water level still rising. And a large chunk of the country still in denial that there's any water here at all.
How do you combat that? Because, I mean, as you say, on the one hand, there's the case of the information being quite clear, the directives being clear, but no one's following it. Do you get the sense from, all the people you get to speak to every day and the events that you do you get the sense that this latest rise in new cases is finally spooking enough people into really understanding that they just need to follow those guidelines?
There's a couple of things that are going on here. First and foremost is we're in the middle of a pandemic, and the worst pandemic in a century. And so as a public health person, we're trying to combat the pandemic. But we're combating a second war at the same time, and that is the war of misinformation. And there is a very large war of misinformation happening. And the good news is that a majority of Americans don't buy it. A majority of Americans don't buy the misinformation. They get the science. They do trust doctors and nurses and public health people. But a large minority, 30, 40%, still strongly believe that this is nothing but the flu. All of this is overhyped. It's political. It's a hoax. Masks are mind control. And that kind of crazy thinking, which is fringe in every other country, has become major in our country and has really hampered politicians' ability to do anything effectively. Certainly politicians on the right, who have become beholden to that misinformation. And so the majority of Americans are very clear, 60, 70% of Americans are very clear that we've got to follow guidelines and do what is right. But that 30 to 40% with that misinformation largely fueled by Facebook as the platform has really become the Achilles heel of America's response.
Of course, and Mark Zuckerberg interviewed Dr. Fauci yesterday, and they touched on some of these very points. We're beginning to get some questions in from our viewers from around the world, Dr. Jha. So I'm going to take one of them and put them to you as we wait for more. Jack Gao asks, how can the US learn the lessons from successful countries like Taiwan in dealing with the crisis at this point?
There's no shortage of lessons that America could be learning. Taiwan has been extraordinary, but there have been others, right? From South Korea to Vietnam, a relatively lower resource setting. Obviously, in Europe, there's Germany and Denmark, and even Italy and Spain, which mishandled things initially, has really done a good job now. There are two sets of problems. One is there's a group of people who sort of have always had the American exceptionalism of we have nothing to learn from anybody else. And American exceptionalism has some real benefits to it, things to speak for it. But when you are the worst performing nation in the world, then that American exceptionalism really begins to harm you. So there are a lot of lessons, and Taiwan would be a great one to follow. Again, I think they've done a great job. But there is still not much of an appetite for a large minority of people to learn because they don't think there's a problem. And if you think you're doing a good job, then you're not really going to go seek lessons elsewhere.
Yeah, and that's grim because there's a feedback loop there where you hear the news you want to hear, and if you think you're doing well, and you can't break that loop. Where do you think this is all headed now? I mean, I guess the title of this event was what the rest of 2020 is going to look like. You've been sort of monitoring the coronavirus right from day one. I mean, I remember we spoke back in March for the first time. What does the rest of this year look like in the United States?
Yeah, so keeping it just to the US, there are some potentially very optimistic scenarios where The states that are really neck deep right now learn their lesson. They turn things around, get things under control. And we go into the fall in better shape, new tests coming, new therapies, and the US gets through the rest of 2020 with maybe, let's say, 200,000 or 225,000 deaths, but not much more than that. There is a more pessimistic scenario where even the states that are doing a good job let off controls too much, and we get really large outbreaks happening across all of the United States. We end up with more than 300,000 deaths. I think somewhere in between is likely the answer. And the way I see it, obviously predictions are hard, but the way I see it is you're going to see two different Americas. You're going to see a set of states that are going to be driven by science and data and evidence, and they're going to keep their virus levels reasonably in check. And they're going to look like Europe in terms of cases. And then you're going to see a set of states that are going to let things really get out of control, and they're going to look much more like Brazil. And America as a whole will look somewhere worse than Europe and better than Brazil, but it will really be two different stories averaging into a middle, but there will be places that will look quite terrible. And that's what I think is the most likely, and it's wholly preventable and very unfortunate that that's where I think our nation is heading.
David Youngblood is asking if there's any chance of a positive outcome without a coordinated federal response in the United States.
It's very hard. And, there are a lot of people who see this as a test of federalism. And I think those people are naive, because federalism, for people who are not deeply into American politics, is really about the idea that states should sort of be the lead on most issues. And I think on many issues, states can be the lead. And in this case, given how bad the federal response is, I'm thankful to live in a state that is having a pretty good response. So there are benefits of that. The problem is there are a certain set of issues that are very hard for states to handle. For instance, testing and getting testing ramped up. These are national and international supply chains. And so the question becomes, do you want the state of Delaware to be competing against China for supplies of tests? Like, that strikes me as really unwise. But the federal government has largely decided that they're not going to do an effective response. And so what I suspect will happen is some states will figure it out, will have the size and expertise, like California, like New York. And many states will struggle, and the whole country will suffer as a result.
And the irony now is that Americans aren't even welcome in most parts of the world. It's almost like the United States has become sort of a pariah state. And what do you think that does longer term to perceptions about the US healthcare system, to perceptions about the United States?
Yeah, I think, this is, it really has done enormous damage to the American reputation. Look, there is something special about America, and has been for a long time. And I had assumed it would take longer than 3 years to really destroy that. I don't think it's going to be destroyed. I think if we get our act together, if we really begin to turn things around in 2021, the scientific community in the United States remains preeminent around the globe. I think majority of people in the world will realize that, and hopefully that this was a blip. This incredibly poor response was not something that was indicative of America in the long run. But America is going to have to do some soul searching about how it goes on to become a pariah state and becomes the one country where people can't travel outside. I mean, it's interesting and ironic that President Trump had started off with this idea of building walls to keep others out. And what he is finding is that, in fact, people are perfectly happy to pay for the wall to keep Americans in. And that's not where we want to end up. And I don't think we will, by the way. I think once we get through this period, there will be a chance for Americans to kind of reconnect and reestablish its important role.
Let's hope so. We're getting some more questions coming in. Jack Hammond is asking, I guess rather darkly, that if the pessimistic scenario you present is likely, and we cannot expect any improvement in the quality of leadership from the national government and some states, how do you advise individuals to respond?
Yeah. Well, the pessimistic scenario I laid out is not in my mind the most likely. I am hopeful that it will be better than But it is a really important question. What can individuals be doing? Because I think a lot of individuals are sitting, and they're sitting at home. They're incredibly frustrated. My personal take is even states that are doing well could be doing better. I'm not somebody who believes at the end of the day that the government is the end all be all for all responses. But I do think we need a more effective policy response in almost every place in the country. And so certainly pushing your political leaders is important. The group that I have been really surprised has been willing to sit this out and not play a constructive role is the private sector. The private sector usually has a very substantial set of influences in the United States. And the fact that like our economy has just gotten really badly beaten, and I expect the next 6 to 12 months to be economically really quite difficult times, I would have thought would motivate the private sector to get more involved. And I don't mean private companies building products for COVID. That is happening, and that is very dynamic. But I mean more like the Chamber of Commerce saying we need an effective response because it's terrible for our economy. So what I recommend to people is if you're a business leader, if you work in companies that have like lobby for an effective public health response, because as most smart economists know, the best economic policy is viral suppression. It's a good public health response. And that's what we ought to do. But we're willing to spend trillions of dollars bailing people out, and we should in this context, but we don't seem to be willing to spend tens of billions or hundreds of billions of dollars to suppress the virus and get the economy going again.
Dr. Jha, let's look around the world a little bit. I mentioned India at the start. For the last 2 months or so, we've seen it rise steadily up the list of countries with the most coronavirus infections. And just today, it crossed 1 million cases. And now it's ranked the third highest, behind only Brazil and the United States. It's not slowing down. What's going to happen there?
Yeah, I've been pretty worried about India. I've been watching it very closely, and I've been very, very worried about what is happening in India. Look, they obviously acted early with a very aggressive lockdown, which I largely supported. And even though there was a very large economic and social cost to that lockdown, especially for the poor, I believed it was the right thing to do. And what I said to policymakers then is that lockdowns, they slow things down, but they don't stop the virus. And as soon as you let go of the lockdown, the virus will accelerate. So the only real reason to do a lockdown, especially early on, is to build the infrastructure to keep the virus under control. And the infrastructure very much is about testing and tracing. I think India's done an okay job on that. It's testing at a reasonable number, but it's not anywhere near what it needs to be. So when I look at India and I think out to the next 2-3 months, I see nothing that really slows down the growth of cases. And so every day, almost every day, the number continues to grow. And I expect that's what will happen in the days and weeks ahead. There are now about 30,000 cases a day, new cases a day. Again, I would not be surprised if by the end of the summer, we're seeing 100,000 new cases a day, or maybe even more.
It seems to me that early in the pandemic, there were some early leaders, Spain, Italy, England. But now what we're seeing at sort of the top of the list of countries with the most coronavirus cases is that they're essentially large countries with very large populations, except China. Is this something that you expected all along, that basically every country will have a certain percentage of its people affected? And so big countries like India, Brazil, Nigeria, Indonesia, Pakistan, Bangladesh will naturally sort of gravitate towards the top of that list?
Yeah, so if you just were thinking about pure number of cases, absolutely. You'd expect countries with large populations will have more cases. But even if you do it on a per capita basis and try to adjust for underlying population, what I think if we're a month or two from now is that my expectation is that a month or two from now, the 4 countries with the highest number of cases, even on a per capita basis, are going to be the US, Brazil, India, and Russia. And that's interesting. It's interesting in that they all have leaders. And India, again, I think Prime Minister Modi has, again, done a very good job. But certainly US, Brazil, and Russia have all had leaders who've essentially denied and really try to downplay the virus initially. And that kind of denialism is not effective. And so it's very interesting to see as we look out over the next couple of months, which countries will have the highest per capita, taking away the tiny countries where per capita numbers can be skewed, but among major nations, that's where I think we are heading. It's not a coincidence, and so size does matter, but it's not the only determining factor here.
Sure. Bonnie Shorshke is asking if hospitals have to gather and send information to the administration, can they simultaneously provide the same information to an alternative data repository under academic leadership that would sort of serve as quality assurance on the data? Do you know if that's possible?
Yeah, well, the easiest thing would be that, hospitals are regulated by states. So all the states could just require that the hospitals also send the data to states, and the states could make it public. So there are lots of mechanisms by which this could happen that wouldn't require creating a whole new entity. It's interesting when you think about right now, the fact that we had 75,000 cases yesterday. Well, how do we know that? What's the data source for that? It turns out it's states. And then it turns out because the federal government has not been collating it in any kind of an effective way, that there's a group of, ragtag group of journalists run by the Atlantic magazine that goes out every single day and collates data from every state and puts it all together so we can have a national picture. And so as long as states are getting it, I think we can get it out to the American people, even if the federal government isn't playing a helpful role.
Okay, we have time for just a few more questions from our audience. Michael Roth is asking that China seems to have effectively managed to contain the virus. That is, if we can believe its data. Michael asks, is that because they were actually effective in managing it? Or as with many numbers coming out of China, are those numbers just not to be trusted?
Yeah, it's interesting. I don't know is the short answer. I think any reasonable person would be right to question the data coming out of China. And so, but at the same time, do I think there are very, very large outbreaks happening across China and where somehow it's all being suppressed? I don't. China is not, isn't going to be able to contain the data and the activity at that level. So I do think China probably has managed to effectively contain the virus. Maybe its numbers are worse than we know. And it's done it very, very aggressively, including using certain tactics that I would not condone. The way they dealt with things in Wuhan in terms of the level of lockdown, I think was both unnecessary and from a civil liberties point of view, harmful. There are ways of managing this virus and maintaining a basic level of civil liberties. Lots of countries have done it. A smaller country that is, I think, been a model has gotten too little attention is Vietnam. Officially, they still have not had a single person die of this virus. And it's not because they have some new therapy or they're a super wealthy nation that can figure. They've just done good, kind of shoe leather epidemiology, public health, and they've acted aggressively. You can do it.
And that's something that must be inspiring for other sort of middle income and poorer countries, because again, if you look at the countries that have done really well, South Korea, Taiwan, Denmark, Norway, a lot of countries that are rich countries or at least high income countries and able to put in place certain measures that say the likes of Bangladesh may not be able to. So in that sense, Vietnam's story is all the more encouraging.
Absolutely. Absolutely.
Surya Sarkar Huot in Canada is asking about the reluctance of Facebook and other social media companies to clamp down on misinformation. And he's asking whether you think Washington or any other groups, what advice you would have for them to improve the information ecosystem around coronavirus messaging.
Yeah, this is a tricky one. Facebook obviously doesn't have to act responsibly. It has chosen not to act responsibly. And whether we want Washington to make changes, I get nervous about the government. First of all, there are limits to what the government can do on regulation. We have a constitution. If a private company wants to be a spreader of misinformation, it probably can be. But just because Facebook can be the major source of misinformation in America doesn't mean it should be. So I don't know that regulations are going to get us there. I'm not even sure what Washington is going to be able to do, even if there is a change in administration. But there is an element of social pressure. And I know increasingly Facebook is having a harder time attracting employees. Talent is, increasingly doesn't want to be associated with Facebook. I'm hoping that some of that internal pressure gets Mark Zuckerberg to realize and decide that he may not want to be the major source of why America is struggling with a pandemic response. But I think at this point, that is the role Facebook is playing, is that it is undermining public health on a daily basis.
Yeah, and I should also point out there are several regulatory sort of approaches to a sort of controlling big tech that are underway in Europe. And we interviewed Margaret Vestager, the competition commissioner there, and her point was that Europe can only do so much, that it can put in place certain measures, but after that, all they can do is really hope that the United States and other countries try to adopt similar measures, because otherwise you can't really control big tech. I have one last question for you, Dr. Jha, and this is from several people. Predictably, I have Thomas Campbell, Shumit Ganguly, who's an FP columnist, and they all want to know what you think about the potential for a coronavirus vaccine. Give us a sense of where we are, what your sense of timeline might be, and then after that, how likely it is that that particular vaccine, whichever one is successful, you could ramp up production quickly enough so that people can get back to their lives.
Great. So let me start off by saying that if you asked 100 public health experts or physicians, medical experts who've been tracking this closely, my view is probably in the kind of 80th to 90th percentile in terms of optimism. I am much more optimistic than the average person on this. So you should just calibrate my answer by saying, but he may be a little bit on the extreme end of things. I think that by the end of 2020, we will not have one vaccine. I think we'll have 4 or 5 vaccines that look promising, that may have enough data behind them for efficacy to show that they work in preventing infections, or at least that they work in preventing severe infections. And there will still be some questions around safety and how much safety data is enough, because we're moving so quickly. There is going to be obviously an effort to ramp up production of a lot of this stuff this fall through Operation Warp Speed. Europe is doing stuff. My guess is that the first vaccine that'll be really shown to be effective will be one of the Chinese vaccines. But when I then start planning out and thinking, when do Americans start getting it? When do the Europeans start getting the vaccine? When does the rest of the world get the vaccine? I definitely 2021. So there are some people who think 2020, and I can't figure out how to get to there, how to get there in 2020. But in 2021, I can imagine people starting to get vaccinated early in the first quarter, some number of people. And really second to third quarter of 2021 is when I see large chunks of the world being vaccinated. I think people are underestimating the difficulties of supply chain in terms of how hard it will be to make billions of doses. The vials, the syringes, the little caps that go on vials. If certain vaccines will require temperature control. And so there's just a huge logistical challenge here that I think we're underestimating. I don't know which vaccine. I don't know. Like literally, there are a good dozen that all look promising to me. And any 3, 4, 5 of them may end up crossing that line by early 2021.
I'm going to squeeze in one tiny last question, Dr. Jha, and this is from Peter Vaughn. He's asking if the second wave is a given, and if so, when should we expect the second wave, let's say in the United States?
Yeah, you got to finish the first wave before you go to the second wave. And for states that are already kind of neck deep in the water, it'll be interesting to see whether people will even notice a second wave. Here's why I think a second wave is inevitable. I said earlier, the single biggest thing we know about this virus is that it spreads really efficiently when large numbers of people gather indoors for any extended period of time. And so right now we can spend in much of the United States, and certainly in the northern United States, a large amount of time outdoors. But as October and November roll around, people will start spending more time indoors. And I expect the amount of COVID cases to start ticking up, even in states that have very good control. Throw in an influenza season on top of that. And I expect November, December, January to be pretty hard months for the United States. And that's why I think people will feel like the vaccine could not come fast enough. And I'm hoping that my optimism turns out to be true. And in the first quarter of 2021, we have a vaccine that starts becoming widely available. But if it's not, then it's going to be a very difficult 4 to 6 months for the United States.
Okay, well, I'm going to leave it at that with you, Dr. Cha, especially since you ended on an optimistic note, and I don't want to change that. Dr. Cha, you're far busier than all of us. Thank you so much for joining us today, and we'd love to have you back.
Ravi, thanks for having me on, and I would love to be back.
Great. Have a good day.
Bye-bye.
Okay, and up next, and as promised, I have the Managing Director of FP Analytics, Alison Carlson, joining us. Alison, you can go ahead and switch on your mic and your camera. Alison and her team have been working on FP's COVID-19 Global Response Index to track and rank how countries are responding to the pandemic. The index ranks 37 countries. Alison, welcome. Thanks for joining us. Tell us a bit more about the index.
Thank you, Ravi. Thank you for having me. And thank you again to Dr. Jha. I really appreciated a lot of his comments and really dovetails well with the work that we've been doing here. The Global Response Index is really looking at policy response around the world and how country leaders have enacted policies from January until now. And while there have been several organizations and policy and economic shops that are tracking this issue, which is critically important, something that differentiates the index that we're compiling is that it's the first to track national leaders' response in these key policy areas. And specifically, we're looking at the ways in which national leaders have implemented public health directives and several submetrics within that, the financial response, as well as the fact-based communication and misinformation as well among national leaders, a very important issue that Dr. Jha raised as well.
So can you run us through some of the key metrics that you're looking at when you rank countries?
Sure. So to start out with, certainly we understand that every country is in a certain position with its own socioeconomic development as well as healthcare infrastructure. And so what we're looking at apart from that is developing a scoring code of sorts for each country in that regard. And as far as that, we're looking at, debt to GDP ratio, rates of infant mortality, Gini coefficients to look at issues of inequality, to really provide a little bit of an assessment of how countries stacked up and their infrastructure prior to this exogenous shock. And then in terms of the responses themselves and what is really feeding into the index are 3 policy scores. So we have the public health directives, as I mentioned, and that we're really looking at stay-at-home orders, school closures, restrictions on public gatherings, and testing and tracing, and some other measures, really integrating and feeding into the scores on that measure.
And I see Denmark and New Zealand at the top of this list. So those are the 2 countries then that have had the best responses. Is that right?
Overall. So those are overall scores according to all of these submetrics. And then that's feeding into an overall score. So those countries have, in fact, acted aggressively and acted early. So one unique feature of the index as well is we are, in some of these metrics, accounting for time. Not only were these policies implemented, but when. And when were they implemented relative to the case and death rate?
I can see a hint of Senegal there, which may be your 5th ranked country. And that surprises me a little bit. Can you give me a sense of what they've done right to rise up that high on your list?
Sure. So there are a lot of fascinating insights that are coming out of the data and the additional information analysis that we're doing so far. And what we're seeing out of Senegal is that the country has really learned from previous crises, including their experience with Ebola from 5 years ago, at which point they've really instituted preparedness plans, and even since done considerable amount of crisis simulations related to public health so that when the next crisis hit, they would be prepared. And so early on in this crisis, and even as early as January, there was a strong public policy plan in place and a greater level of preparedness because they had planned for it. And so I think there are really lessons to be learned there. And those measures were put in place before even their first cases and deaths were reported.
I have to ask, Alison, does the US even make your list?
It is toward the bottom, unfortunately, and as Dr. Jha articulated very well, we're not performing very well.
Okay, well, Alison, thank you for that. I guess to find out where exactly the United States is on that list and how it compares to other countries, we'll have to wait for the launch of the index to find out answers to all of those questions. Thank you, Alison Carlson. Insiders, the COVID-19 Global Response Index will be out at the end of July. You need an insider subscription to access it. Of course, go to foreignpolicy.com to find out how you can sign up. And you can also see several other special reports by Alison and her team, really cutting edge stuff on 5G and national security, on gender in the workplace, and much more. That's all we have time for today. I'm Ravi Agrawal, Managing Editor of Foreign Policy. Thank you for joining. Thanks for supporting us and our work. And as always, you can read our 50 plus articles a week on foreignpolicy.com. Thanks for joining. Stay safe and have a good weekend.